Welcome. My name is David Smith. I'm a licensed clinical social worker and the owner of Thriving Family Therapy, a multi-state private practice specializing in neurodiversity affirming and trauma-informed care for people with autism, ADHD, complex trauma, complicated families and parenting situations, and healers and other helpers struggling with chronic levels of toxic stress and burnout. I'm also a late diagnosed autistic adult myself, as well as someone who has experienced many of the issues I help clients with in therapy. As someone who wasn't diagnosed with autism until I was 56 years old, I spent most of my life not understanding why the world felt so confusing and overwhelming. So I'm not just some kind of white-coated expert with a bunch of letters after my name. I'm a fellow traveler who has walked the path toward healing myself, and in fact, am still walking that path. Today I want to talk to you about a core concept underlying my work, neurodiversity affirming care. I'd like to define what that actually means, what it is, what it isn't, and why it matters so much for autistic people, ADHDers, and other neurodivergent people and their loved ones. This is important material because the reality is the way we've traditionally approached autism and ADHD and other forms of neurodivergence has caused real harm. It's been pathologizing, and it has tried to teach people how to be something other than their true selves. There's a better way. So let's start with the basics. What does neurodiversity affirming care actually mean? Neurodiversity affirming care doesn't see autism, ADHD, or other forms of neurodivergence as disorders that need to be cured. Instead, it recognizes that different brains have different needs, strengths, and ways of navigating the world. The focus shifts from trying to make someone be or act more normal to helping them thrive as their authentic selves. Here's what that looks like in practice. First, it's about accepting neurological differences as natural human variation, not as pathology or disorders. The neurodiversity paradigm views conditions like autism and ADHD the same way we view other forms of human diversity. Different isn't deficient. It's true that both autism and ADHD, as well as the combination, which we know of as ADHD, can absolutely be challenging to live with, and in their more acute forms can hamper a person's ability to function in many areas of life. But being neurodivergent doesn't mean you're a broken human. It means you were wired differently from the moment you were developing in your mother's womb, and as a result, you experience the world differently than a neurotypical person might. Second, neurodiversity affirming care is strengths-based. Instead of only focusing on deficits and what needs to be fixed, we identify and build on individual strengths and capabilities. Every neurodivergent person has unique gifts and abilities that should be celebrated and supported. Unlike the traditional mental health model, which is inherently pathologizing and labels any differences from a hypothetical norm as disorders, neurodiversity affirming care helps you discover what is right and good and true and powerful in you, and uses those areas as the foundations to build a more fulfilling, joyful, and peaceful life. Third, it's collaborative. Neurodivergent people are the experts on our own experiences. In neurodiversity affirming care, we work as partners together. I walk with you as a fellow traveler and collaborator, not as an authority figure who knows what's best. You get to be the expert on you. Fourth, it emphasizes environmental change over forcing conformity. Rather than demanding that neurodivergent people change who we are to fit into a neurotypical world, we look together at how to modify environments, remove barriers, and create spaces where everyone can thrive. And finally, it respects autonomy and authentic self-expression. This means honoring how you communicate, how you stim, how you regulate, all the things that make you, you. This is built into the whole way I practice, starting with the fact that because I do all my work by telehealth, you get to do sessions from wherever you feel most comfortable and safe, whether that's your home, your car, your office, walking in a park, whatever works for you. Now you might be wondering, isn't this just good therapy? Why do we need a special term for this? The answer is this. Because traditional approaches to autism and ADHD have been, and often still are, focused on compliance and conformity, labeling things as disorders, pushing medication as the only or primary option, and other things that are not entirely helpful. For example, the most common intervention for autistic children, the so-called gold standard, has been applied behavioral analysis, or ABA. And while ABA has evolved somewhat over the years, the traditional model was built on trying to make autistic kids look and act less autistic, often using punitive or pathologizing methods. ABA would teach autistic children to make eye contact even when it's painful, to suppress their stims, to push through sensory overwhelm, to mask who they really are, and make that a habit they would adopt for the rest of their lives. Research now shows us that autistic adults who went through traditional ABA often report experiencing trauma from these interventions. They describe learning to hide their authentic selves, to push down their needs, to perform normalcy at tremendous cost. For many of my autistic clients, traditional methods such as ABA are viewed with so much suspicion that any therapist who has been involved in ABA treatment at any point of their career is considered untrustworthy. I understand this point of view. I believe we should be working to help people, including and especially children, work with their inherent nature, not try to extinguish it or teach them to mask it. And here's the really critical piece. We now have solid research showing that this kind of masking, what researchers call camouflaging, is directly linked to worse mental health outcomes. Studies have found that higher levels of camouflaging are associated with increased anxiety, depression, and even suicidal thoughts and behaviors. Autistic adults describe camouflaging as exhausting, isolating, and leading to loss of identity. We spend so much energy trying to appear normal that we burn out, lose connection with ourselves, and end up with serious mental health struggles. Multiple systemic reviews and meta-analyses have confirmed this pattern. The very interventions that were supposed to help autistic people have, in many cases, caused profound harm. I can testify to this myself. Although I never went through ABA because I was not diagnosed as a child, as someone who was camouflaged all my life without even knowing I was autistic, I spent decades dealing with depression, anxiety, and a pervasive sense that I was just a broken and failed human being because I could never get it right. I was always either too much or not enough in any given situation. Constantly told I was doing it wrong, never quite fitting in. I spent so much time trying to be whatever I needed to be in order to fit in, or at least be invisible and thus safe from criticism, that I lost sight of who I was underneath the camouflage. I'm still working on finding my true self, the authentic version of me that I would have been if I wasn't trying to play a role or be accepted by whoever happened to be around me. I'm getting better at it, and authenticity and integrity are among my deepest, most central values, both as a therapist and as a human being. So when I say neurodiversity affirming care represents a different path, I mean it. This isn't just about being nicer or more politically correct. It's about recognizing that the old way has been hurting people and choosing an approach grounded in dignity, autonomy, authenticity, and respect. So what does neurodiversity affirming therapy actually look like in practice? What would it be like to work with someone like me? First, it means we're not trying to eliminate autistic or ADHD traits. We're not working on goals like to reduce stimming or increasing eye contact or helping you sit still in your seat. Those kinds of goals are about forcing conformity, not about helping you thrive. Instead, we focus on things like managing co-occurring mental health challenges like anxiety, depression, or trauma, helping you understand how your unique nervous system, body, and mind work, and working together to create the user's manual that you never got. Learning ways to manage stress and stay within your window of tolerance, which is at the core of a lot of our struggles as neurodivergent people. Understanding how your sensory profile works and finding regulation strategies that work for you. Building self-advocacy skills so you can communicate your needs. Navigating a world that wasn't designed with neurodivergent needs in mind. Processing the grief and anger that often come with late diagnosis. And healing from experiences of bullying, rejection, unwanted masking, persistent microaggressions, and chronic invalidation, or even full-blown trauma. And supporting your relationships and helping your loved ones understand you better. Next, we adapt our therapeutic approaches. So-called gold standard therapies developed by and for neurotypical people, such as CBT, psychoanalysis, and so on, often just give us a better insight into why we're messed up from a neurotypical standpoint, but don't make us any less messed up. because the challenges we're having aren't driven by thoughts or emotions. They're driven by our sensory and nervous system responses and our limbic system's fight, flight, freeze reactions. Insight-based therapies alone often don't touch this because the parts of our brains that are involved in our struggles aren't connected to the parts that are involved in traditional talk therapy. So neurodiversity affirming approaches often use methods like somatic and sensory techniques, brain spotting, and other trauma-informed interventions to help regulate the limbic system, internal family systems, and other more modern forms of therapy, or play-based and expressive therapies, modalities that tend to be more effective and less distressing for people. We work on stress, your sensory environment, your surroundings, and your relationships. We adjust how we communicate, how we structure sessions, and what we ask of you. Maybe you need to move during sessions. Maybe you communicate better in writing than verbally. Maybe you need more direct communication and less reliance on neurotypical social cues. Maybe you prefer to have no eye contact or have sessions in your favorite pajamas. All of that is honored and accommodated. Third, it means recognizing and validating your experiences. If you're telling me that something is painful, overwhelming, or impossible, I believe you. I'm not going to push you to try harder or get out of your comfort zone in ways that are potentially harmful. I respect your pacing, your path, and your choices. Neurodiversity affirming care doesn't mean we ignore challenges or struggles. Life can be really hard for neurodivergent people because the world isn't set up for how our nervous systems work. Part of this care is acknowledging that reality and validating how exhausting it can be to constantly translate between your way of thinking and neurotypical expectations. It's recognizing the grief and trauma that often come with living in a world that tells you you're broken just for being yourself. Now you might be wondering, does this actually work? Is there research to support this approach? And the answer is yes, increasingly yes. Studies on identity-affirming mental health treatment for neurodivergent individuals have found better mental health outcomes compared to traditional approaches. Neurodivergent people who receive affirming care report less anxiety and depression and greater self-acceptance. Research specifically looking at interventions that support autistic identity and work toward changing the environment rather than trying to change core autistic traits shows improved mental health outcomes and greater self-acceptance. And here's what we know about the alternative. Trying to force neurodivergent people to act neurotypical doesn't work, and it causes harm. The research on masking and camouflaging is really clear on this. Now, I want to be honest with you. This is still an emerging field. We need more longitudinal studies, more diverse participant populations, and more rigorous research. The evidence base is growing, but there's still a lot that we don't know. What I can tell you is that both the research and the lived experiences of neurodivergent people point in the same direction. Namely, that approaches that honor neurodivergent identity, that focus on acceptance and support rather than conformity and compliance, lead to better outcomes and less harm. And here's what I know from my own life. I spent decades not understanding why I struggle with things that seem so easy for everyone else, why social situations were so exhausting, why I couldn't just deal with bright lights, crowds, stress, and loud noises, why my mind explodes when my train of thought is interrupted, why I can't handle things coming at me from my peripheral vision, especially in chaotic and unpredictable forms of movement, and why I always have felt like an alien observer in social situations, out of place and awkward, just in the world itself. I thought for many years that there was something fundamentally wrong with me. I struggled with anxiety, depression, and fragile self-worth, despite all my accomplishments. I learned to mask, to hide who I really was, to present a version of myself to others that I thought would be acceptable. I did this even with those closest to me, my family, my kids, my wife, my closest friends, and it nearly destroyed me. Getting diagnosed as an adult in 2024 at age 56 changed everything. For the first time, I understood that I wasn't broken. My brain just works differently, and there's nothing wrong with that. It gave me a lens through which I could reinterpret many things in my life and about myself that had always been confusing. It also helped me understand why so much of the therapy and medical care I'd received over the previous 35 or 40 years had been unhelpful at best and damaging at worst. This is why I'm so passionate about neurodiversity affirming care. because I've lived on both sides of this. I know what it's like to be told you need to change who you fundamentally are and how you show up in the world. And I know what it's like to be finally seen, understood, and accepted as you are. That's what I want for every neurodivergent person I work with, whether that's you, your child, your partner, or anyone else you love. I believe it's also essential for therapists, medical providers, employers, educators, society at large to understand what it means to be neurodiversity affirming so we can all work together to make the world a less hostile and challenging place for people like us. In some Native American traditions, it's said that when you heal yourself, you not only heal your descendants 7 generations forward, but you also heal your ancestors 7 generations back. This is a beautiful belief in my mind. Healing ourselves is powerful work, maybe the most important work there is. By learning to accept and celebrate neurodiversity rather than pathologizing it, we're not just helping individuals, we're shifting culture, we're healing communities, and we're creating a world where different minds are valued and supported. Look, taking charge of your healing journey is a heroic step. Change isn't always easy. It requires courage, dedication, self-love, persistence, and a willingness to embrace change, which is often hard. You'll need to be curious, open-minded, and willing to do sometimes difficult mental, emotional, relational, and spiritual work, as well as to change thoughts and habits that might have served their purpose when you developed them, but are no longer helping you live your fullest and best life. Having someone walking alongside you on this journey, a trustworthy companion and mentor, can make all the difference. Someone who has walked the path before, knows the pitfalls and opportunities, can give you a shoulder to lean on, and helps hold a safe space where your hot mess times are not just tolerated, but celebrated, because that's where the change happens. Whether you're a neurodivergent adult, a parent, a caregiver, or a professional wanting to provide better care, neurodiversity affirming approaches offer a path from surviving to thriving. You don't have to keep pushing through this alone. You don't have to keep forcing yourself or your loved ones into boxes that don't fit. There's a better way. If you'd like to learn more about neurodiversity affirming care, or if you're interested in working together, you can find more information about me, my practice, and my philosophies at my website, thrivingfamilytherapy.com. The initial consultation is always at no cost, because if you're going to be asked to trust someone to walk with you through the most challenging and personal issues in your life, you deserve to know whether or not it's someone you can feel safe with. Thank you for watching. I hope this has been helpful. And remember, you're not broken. You're not too much or not enough. You're exactly who you're supposed to be. Let's figure out together how to help you thrive.